Hello and welcome to the STS podcast.
I'm your host, Iman.
And I am Mariam.
So today we've got a very exciting guest with us, Zohra. Now, Zohra's not a dentist. I thought she was a dentist. Zohra, can you tell us about your role as an oral health therapist, what that entails, and how long you've been working in this space?
Yeah, I'm an oral health therapist with Adult Scope. So I've been practicing for over 12 years. And oral health therapy is basically dental hygiene and dental therapy dual qualification. We practice clinical dentistry, so preventive. We do checkups, cleans, x-rays, fillings, extractions of baby teeth, but we don't have the full scope as a dentist. So the major dentistry like endodontics, prosthodontics, oral surgery, that we leave to the dentists. But we're providing the triage, the screening of the patients in general. Pretty much we're like the GPs in the dentistry world. And then the dentists take over and specialize with the major treatment.
So you still do like fillings and yeah, oh, okay. Dental cleaning.
Yep, all of
Yeah.
that.
Okay, cool.
You were mentioning before what type of qualification that is. Could you tell us a little bit more about that?
Sure. I studied the Bachelor of Oral Health at the University of Melbourne. So, Bachelor of Oral Health is a 3-year undergrad. I went on to do one more year of honours at Melbourne Uni as well. So, the year after, so 4 years all up. I've also done the graduate certificate in dental therapy, which is an adult scope. So, to be able to treat adults and do fillings on adults, that's some extra training that you need to do. I'm also a certified orofacial myofunctional therapist, which is a little bit more about the muscular side and functional side of the muscles in and around our head and neck rather than just the teeth. So, in that way, I like to take a holistic approach to dentistry and not just talk about teeth and gums.
That's so awesome. I remember when I first discovered like orofacial myology and all that sort of stuff a few years ago. It was completely new to me. And when I was going through my own journey with grinding and just, yeah, like a lot of oral sort of muscular issues, not the dentist that I was seeing at the time wasn't really able to provide, again, that the holistic sort of integrative care. So I was really fascinated by just that profession, and it's so niche, like it's not really easy to find orofacial myologists, or there's not a lot of understanding around what that sort of role entails as well. So yeah, I'm very curious about it, but I'm sure our listeners are also very curious, and I know there's a really broad scope in which you guys work as well. What would you say a large proportion of conditions or things that you are seeing in clinic at the moment, or things that you're supporting people with right now?
Yeah, and definitely you mentioned grinding. But what we find is any muscular dysfunction in the head and neck. So if we have TMJ, so you joint disorders,
Mm.
temporomandibular joint disorders, any pain associated with that, headaches that are associated with grinding, headaches associated with joint pain, and also thumb sucking for the younger patients, some older patients as well, oral habits. So cheek biting, lip biting, tongue ties, lip ties. Um,
Tongue
yeah,
ties.
parafunctions, yes. Dysfunctions of the muscles in and around sort of the teeth and the gums that we use daily. So it can incorporate exercises that we help to rehabilitate proper breathing, proper chewing, swallowing, speech. So a lot of the times we'll have speech therapists who can do myofunctional therapy as well, because they find that that sort of adjunctive therapy does help in sort of speech sound targets. So a lot of the times what we're finding is patients who come in and say, something's wrong, I'm not sure what it is, it's not my tooth, it's not my gums,
Mm.
but nobody else seems to understand the oral complex, and that's where we come in.
Would it be likened to sort of a let's say oral chiropractor?
Almost, yes. I am also trained in temporomandibular joint disorder releases as well, so fascia, neuromyofascial release, which is it kind of ties in together because you can't release and sort of work on the muscles like an osteopath or a chiro does
Mm.
without the rehabilitation as well.
Yeah.
So yes, I do the neuromyofascial release, which is similar to what an osteopath or a chiro would do. We're working on manipulating the fascia, getting some nerve stimulation, getting the brain to do most of the heavy lifting in terms of releasing tight muscles, in terms of reducing pain and taking the load off the temporomandibular joint. And then the myofunctional therapy comes in to help strengthen the tongue to take off the load of that joint and the muscles. So the tongue should really be doing a lot of the heavy lifting in and around the mouth. And a lot of times we compensate with our lips, the muscles in our lips, muscles in our cheeks, in our neck,
Mm.
which then have to be employed because the tongue's not doing what it needs to do. So as a myofunctional therapy, it's the tongue that we're mostly sort
You
of
know,
working.
So interesting, because we were actually chatting about a really similar topic in our one of our last episodes with Dr. Vida. She's a breastfeeding medicine doctor, and we were talking about tongue ties and the suction of the nipple in the mouth for a baby, and how important that suction is, and that tongue sort of function in breastfeeding. But I think a lot of people often forget, how important these functions are as, a child grows and progresses through life. And I think there's so much of a focus on it for babies, and in that early life. But then I think a lot of things do go miss. Like, I know I've got like a nephew at the moment. He's about 7 or 8 years old, and he's actually just about to get a tongue tie release now. But he's been struggling with like oral muscular issues for a long time, issues with speech. Like, there's actually been a lot of things going on, but sort of missed. There wasn't adequate sort of holistic care and a holistic assessment as to what would be the best sort of treatment outcomes for him. But yeah, this is like 8, 9 years later. So it was actually discovered earlier on, but she was told that it's not that big of a deal, which I'm sure that you hear that a lot. It's not that big of a deal, or it doesn't impact their function. And so I think, you've mentioned some really good points about all these professionals that you sort of work alongside and, sort of refer to one another. But do you think that there's still maybe not enough understanding or referral to the right professionals in this space? Because that's sort of my observation.
Absolutely. I think a multidisciplinary approach is so important in general in healthcare. A lot of the times the mouth is seen as sort of in isolation of the rest of the body. Like, you'll go to a GP and they'll help you find a specialist or find, the professional that you need for the rest of your body, but somehow the mouth is treated completely separate. And unfortunately, yes, we need that multidisciplinary approach. We need to be communicating with other health professionals, because the gaps that we may not recognize in our knowledge, another professional will be able to pick it up. So definitely we work with lactation consultants, speech language therapists, pathologists. We send to osteopaths on a regular basis, physiotherapists, because if we are working in the oral complex, we're working in the head and neck, that's not disconnected from your shoulders and your upper back and your lower back. And we find that working in, we've had adults who are in their 50s and they have a tongue tie, and it's affected their balance, it's affected their pelvis tilt, it's affected their, how their knees and their toes and their ankles and all of this is sort of aligned, or misaligned. So a lot of the times when we are going to a professional to try to find out what we need, it is a niche topic, but some professionals don't have the tools, and I certainly don't have all the tools either. And then that's why it's so important to recognize that this is where my limitations begin, and this is where someone else's professional help can really benefit. So yeah,
I could imagine as well. I don't know if you get stroke clients referral, but strokes, when they get dysphagia, and that would be useful. You would be quite useful in that area as well, wouldn't you?
Yes. Dysphagia, we work a lot with, dysphagia, which is dysfunction in swallowing. So any kind of rehabilitation got to do with the muscles in and around the head and neck, absolutely. My functional therapist would be a good place to start. And often we are the center point for a lot of referrals as well. So if a patient does come in and they need to see another specialist, like an ENT, for example, their airways are obstructed or they're not breathing correctly, they've got sleep apnea, we are often the central point that refers to all of these specialists, and we collect all of the reports that come from these other specialists, and then we're able to report to the patients exactly how we can help them and inter with what the other specialists are recommending. So
would it fall under allied health, or is it falling under medicine?
it's actually falling under just adjunctive therapies.
Okay.
So it's not fully recognized. So under APRA, for example, my functional therapists don't have their own sort of registration, but it is a growing profession. And it is the time what we find now, dentists, orthodontists are recognizing the need for orofacial myofunctional therapy in their treatment as well. So you can treat the teeth, you can't use orthodontics as a treatment method without understanding the role that the tongue plays, the role that the oral habits, how we swallow, how we're speaking, how that affects where our teeth end up growing and the shape of our jaw and all of the development of pretty much their head and neck.
Because they use OT like, for example, with stroke patients, and I don't feel like they target specifically so obviously we're talking paralysis of partially of the face and then the muscles, down here. And I can't, through my experience, I haven't seen them very effective in how they treat and target paralysis or partial paralysis
And this would
and
be a great
dysphagia.
therapy for them to pick up. So we're seeing these professionals who, yes, they have their mainstream profession, and adjunctive therapies are just, bettering their
Okay. That'd be something good to keep in
Yeah,
mind.
my understanding is that it's mainly private health. Is that right? In terms of people being able to, into the financial support for
Yeah,
accessing the service.
unfortunately, Medicare doesn't cover even for the younger
That's
patients.
why. Okay. Yeah.
It's
Yeah,
even it's very similar for us
Okay.
professionally as well. Like I know we're getting back onto private health soon, but even for nutrition, because I use my postgrad nutrition qualification for private health. Even when I actually I went for an assessment actually myself. This was years ago at MyoFocus Melbourne. I'm sure you know about them. I think they're in Flemington.
yeah,
Um, I didn't end up going ahead actually because at that point in time it was an inaccessible sort of treatment plan. It was actually going to be very expensive over a long period of time. But yeah, I do remember that and I think that maybe is a barrier or a
100%.
limiting factor
Yeah.
in access for some people because I can imagine that there's a lot of people that need the service, need the support, need that integrative sort of management, but might not again be able to access that. And there's not a lot of clinics around from what I'm aware in terms of like, even when you reached out to me, I was like, oh, wow, this clinic looks awesome. But like, it's all the way in Dandenong, which, for our listeners, that's like, we're from sort of north side Melbourne. So that's a bit more east side. So yeah, and then even the other clinic that I mentioned is more, towards Flemington, sort of in the city. So there, I wouldn't say that, I think the government maybe we need to see a bit more sort of investment in this area or more accessibility because I do think it's a very valuable profession.
Because they're not going to be then recommended or as a part of rehabilitation otherwise. So
yeah,
for my dad had a stroke in 2023, and so it was physiotherapists and OT, and what I observed was that they mainly focused on his hand because he had right arm paralysis. But the only solution they had for the dysphagia and the issue swallowing was basically they do the thickened fluids. So everything had to be thickened. Other than that, there was no other therapy. And I was like, surely there has to be something else to help my dad
yeah,
at this stage.
yeah,
Completely unaware that there was such thing as, an oral therapist. That would have been handy to know at the time. But it can get really bad, and the slurred speech can get quite bad.
yeah.
So it would have been quite helpful to know, but at least now I can at least have that in my scope and I can make those recommendations to anyone who needs it. So this is really important. Yeah.
Yeah, I have referred a few like clients of mine, especially like pediatric clients that are either struggling with like speech delays or sort of any neurodevelopmental challenges and impacted even with their struggling with their diet. If we think that there's something sort of oromuscular going on, I often do refer for an assessment, and sometimes they're able to pursue that, and other times not. But yeah, I would love to see sort of changes. We could talk about that for days. I think in terms of the government needing to do a little bit more in terms of improving
I can imagine
accessibility.
anxiety as well. You'd be able to help with anxiety because the what happens when they're anxious, they're tightening those muscles here. And
Yeah,
so a lot of the time they refer to a holistic dentist so they can loosen those muscles. So I'm assuming an anxiety picture patients you'd be able to really see as well. Am I
yeah,
right?
definitely.
Yeah.
And that feeds into general dentistry as well. There's anxiety associated with coming into the dental chair,
Mm.
unfortunately. So to be able to say, no, it's not all drilling and filling. You can come in and we can look after other things without having to worry about the needle or worry about,
Yeah.
pain or blood and things like that. But definitely the government does need to do more. And I think there's a lot of push to get Denticare, to get Medicare for dental. The NDIS, so we can charge through NDIS
Okay.
with myofunctional therapy because a lot of those patients who do have, developmental disorders, they can benefit from these adjunctive therapies because a lot of the time speech is involved, swallowing is involved, there's oral habits, there's thumb sucking, nail biting. There's a lot of benefits that can be achieved from improving sleep and airway
Mm.
health as well. So there's airway dentistry that comes in that is a piece of the puzzle as well. So
For
patients
like sleep apnea and things like
sleep
that, you mean?
apnea,
Yeah.
sleep disordered breathing. So in the younger patients, it's sleep disordered breathing and pediatric sleep health. There's zero tolerance for any noise or any kind of snoring for children. So if we find that children are snoring or they're breathing with their mouth open at nighttime, that's considered sleep disordered breathing, and they need to be rehabilitated to establish habitual nasal breathing because this is going to affect their mood. It's going to affect their behavior. It's going to affect their ability to control their impulses throughout the day. I mean, adults, when we're tired, we caffeinate and we're okay. We get through the day. But often tiredness in adults look like? Lethargy, we slow down. In children, it's actually opposite. Hyperactivity is a sign of tiredness. And there's been a lot of research to show that if we improve airway health and sleep um, conditions or sleep quality for children who do have ADHD or suffer from any kind of anxiety, that it improves their symptoms throughout the day. And these children, sometimes they're going through primary school and they're not getting a good night's sleep because they have enlarged tonsils, enlarged adenoids, they've got a tongue tie not allowing them to breathe properly, and they're labeled as difficult children. They're labeled as the troubled child, and that gets carried on into their adulthood, which is a shame, because oftentimes, and we'll find this through infancy, from the moment an infant is born to the time that they're growing up, they do things for a reason. They're not being difficult. They're not doing it just because they want to give us a hard time. Oftentimes, if they're breathing with their mouth open, if they're having trouble regulating their immune system, all of this is connected to something that's not balanced. In the way that they're using their muscles, in the way that they're breathing, chewing, connecting with the world around them. And that's why oftentimes we miss it. If we do miss it, it gets into adulthood and you've got an adult who also can't, regulate. Yeah.
Yes. Yes.
Yeah.
I put my hand up because I'm going through the process of getting support with grinding and mouth breathing, and so I'm doing a lot of. So anyway, we'll talk about that a bit later.
I don't know if you want to cut this out or not, just briefly. Just so for the listeners who want to know, like, what's the price range here we're talking if we wanted to see someone like you? You
Yeah.
don't have to give an exact figure, but
Yeah, that's okay for initial consultation. So we can charge using different item codes with private health. So it's not a complete lost cause yet. So we can charge as a first initial consultation is about $110. Following from that, myofunctional therapy needs 3 weekly review appointments where we modify the exercises. So we're giving a lesson plan for the first session. Then we see you again every 3 weeks after that. And each session is typically between $90 to $110 as well.
So it's affordable.
Okay. Yeah, I mean, long term, if we're thinking about the benefits, I mean, how much do we put into orthodontics to straighten our teeth? How much do we put into, other sort of adjunctive therapies to improve? And if we can incorporate myofunctional therapy or understand its place within oral health and general health, then it definitely is worthwhile. The benefits outweigh a lot of the costs that are short-term costs involved, and definitely there are payment plans in place as well. So we want to be able to help patients, and certainly cost shouldn't be a factor. In that way, we're not charging thousands of dollars for this.
I love that. Yeah. Perfect.
Awesome.
Yeah.
Zohra, you already touched a little bit on sleep disordered breathing and neurodevelopmental conditions, and obviously and I have a bit of an understanding around this topic as well, but I'd love for our listeners to understand a little bit more about what sleep disordered breathing looks like, so what they can sort of look out for in their children if they're concerned, and what would be the best steps to sort of go about managing that and what that team would look like.
Yeah, sure. So sleep disorder breathing is basically any type of breathing at nighttime while the child is asleep, or adult. I mean, in adults, we call it sleep apnea because it's very loud, obvious snoring. But in younger children, we're looking for open mouth breathing. We're looking for an extended neck. So if we have the chin up and we're sleeping like this, it's just the body's way of trying to open up the airways at nighttime. Any kind of noise, so heavy breathing, snoring, waking up multiple times throughout the night for a drink of water because their mouth has been open and it's dried out. Bedwetting can be a sign of sleep disordered breathing. So after the age of about 3, if we still find that the child needs to have a night nappy, or if they're wetting their bed even once a night, then that can be a red flag in terms of how their body is dealing with how much oxygen they're getting in at nighttime. Other sort of symptoms are tossing and turning, waking up unrefreshed. So we're tossing and turning because the brain is also trying to adjust to get maximum oxygen input and carbon dioxide release. So if even as adults, if we have a really bad night's sleep and we wake up, we're unrefreshed. So how do we know that the child is unrefreshed? They wake up, their blanket is all over the place, they've been tossing and turning. If you're not co-sleeping, you're not aware of this happening. But the brain tries to sleep on one side, not getting enough oxygen. I'm going to turn every 10, 15 minutes to try to get those airways open. So getting hot and sweaty in bed, waking up, and we're not very happy, even if we've had 12 hours of sleep and we're just not happy. Dark circles under the eyes. We've got that open mouth posture during the day as well. So if we find that kids are open mouth, they've got very snuffly, congested nose, droopy eyelids, if we find that top eyelid comes lower and covers the top part of your the cornea, These are all signs that something's not going right with their sleep. And of course, the behavioral,
Yeah.
if they're, if they're very quick to snap, they're fidgety, they're moving constantly, that can be a sign. It could be a sign of other things as well, but it's good to have this at the back of your mind. So behavioral, mood related. A lot of the times also we find that these patients, when they're waking up and they've got those issues, they can't concentrate in school. So
Mm.
if we have behavioral
Nice.
issues in class, can't concentrate, not picking up the lessons, let's figure out what's happening in their sleep. First port of call. I mean, breathing is the first thing that we do when we are born, and the last thing we will do when when we leave this
Yeah.
world. So breathing is going to be the number one priority of our nervous system to try to regulate. And if that's not right, if that's not balanced, then everything else has to compensate to try to optimize that.
So what about if they are not mouth breathing necessarily, but it seems like they're having difficulty breathing with their nose. So it's quite loud, it feels congested, and they don't have a cold. Is
Yeah.
that, yeah, fits under
Still,
that
that's
umbrella?
a
Okay.
red flag, yeah, because oftentimes we shame children in closing their mouth.
Mm.
So when they're sitting around, oh, why is your mouth popped open? It's seen socially. And I feel evolutionary, we've recognized that having the mouth open and breathing through a mouth, we have it's a negative term, but we said mouth breathers as if it's an
Yes. Yeah.
insult. But socially and evolutionally, we've recognized that having the mouth open is not optimal. It's not
Mm.
ideal.
Yeah.
So even if we shame children and close your mouth when you're chewing, close your mouth when you're sitting down, why do you have your mouth open? Or even if they feel their mouth is drying out and they close their mouth, what then happens is their body is in a state, the nervous system is in a state of stress, of fight or
Mm.
flight constantly. So you can imagine yourself being underwater in a pool. The longer that
Mm.
you are underwater and you're not able to release the carbon dioxide and take in some oxygen, anxiety increases, and it's your body's way, and the nervous system is there to
Mm.
protect us. It's the body's way of saying, we need to do something about this. This is an urgency. So when
Mm.
a child then is breathing, sort of visually, they're breathing through their nose, but they're not gaining optimum oxygen intake and carbon dioxide outtake,
Mm.
then they're pretty much existing in a state of fight or flight constantly.
Yeah.
And
Mm.
that's why we snap really quickly. That's why we
Yeah.
can't regulate our nervous system. The smallest things become a big thing. We've got children screaming and
Mm.
tantruming in the middle of, 2-year-olds, 3-year-olds
Mm.
tantrum. Why is it sometimes those children that don't have a good nap in the middle of the day, or those children that don't have a good night's sleep, they're tossing and turning, they've got airway issues, they're the ones that tantrum harder. So it happens really quickly and it
Mm.
escalates really quickly as well, because our nervous system is there to help us regulate our emotions. But if the nervous system is not in the best state because of our breathing, and we talk about
Mm.
breathing therapy is very, very helpful to learn how to breathe in through our nose and
I need to book an appointment with Zohra
yeah,
for myself.
yeah, and you can imagine you're trying to get on with life. There's so much happening with your life, but you're breathing. We've never really been taught how to breathe. And it's a
Mm.
shame because we often think it's instinctive, just like we say for babies who are born, oh, you should be able to breastfeed. It's instinctive. It's the most natural thing. So is breathing, and somehow we're still not getting it right. So
Yeah.
yeah, there's a lot of things that we need to look into, and this is for the
Right,
health
and
of
then
our children.
I think breath holding is very common too, not exhaling fully. Like
Mm.
I know that for myself, even when I breathe, like I know that I don't fully exhale sometimes, and it's almost because I'm always just like, all right, what do I have to do next? And it's just, we're so out of touch with, like you said, the importance of breathing. And I think once you're used to particular patterns, you just continue sort of going along that way. But then eventually it catches up to you, like you said, and shows up in all these different ways. And I think for children, what I find is that it's often quite obvious if they're struggling with these things, because they do show up with a lot of these symptoms, and getting it addressed earlier in life is much easier than getting to my age and then trying to fix all of these things. But yeah, I'd love to ask, is there's a lot of adults that you work with in this space as well. What would be the sort of ratio of like supporting children, especially around the sleep disordered breathing space, sleep apnea,
Yeah.
even I'm sure with the children that have ENT issues going on at the same time.
Yeah, yeah, definitely. So I would probably say we're at a ratio of 80% kids, 20% adults. And I feel that's because as we grow, that's not on
Yeah.
the agenda anymore.
Yeah.
We've straightened our teeth, we've extracted 4 healthy
Yeah.
adult teeth because we want to make space to straighten our teeth, but we never understood why our jaws grew small in the first place. And it was because of the location of the tongue. The tongue doesn't sit on the roof of the mouth. It doesn't put pressure forwards and sideways to grow the jaw. Sits low because we're mouth breathing or we have obstructed airways, and therefore we have to then traditional braces, you're taking out adult teeth to make space. But what happens is then we're collapsing those
Yeah.
jaws into the airways further. Then we get to adulthood, and the only time that we see these adults come through is when they have jaw dysfunction. So if they have the disorder from
Okay. Yeah.
headaches,
TMJ.
grinding, they're not having a good night's sleep for years. They're on a CPAP machine, and then they've realized, actually, I can't live the rest of my life on a CPAP machine. Something needs to change because you're going on holidays with a CPAP machine. So if there's
Yeah.
anything that you can do to help avoid that, because then that is a lifelong commitment. Unfortunately, that's why we're not getting adults until something goes really wrong.
Yeah. I'm fortunate enough to have a really good sort of integrative dentist who's very much aware of us, sleep disordered breathing. And this is a personal question from me. I have a splint that I'm meant to be using every day. I already know what you're going to say to this question, but I'm presuming a splint is not enough, you know?
It depends on the splint. So there are splints that bring forward your lower jaw to open up your airways.
It's one of those. It's a
mandibular advancement splint. Right.
It's a $2,000 splint. Yeah.
Yes.
And
yes.
Okay.
I was going to say, you're not just fortunate enough to have integrative dentists, you're fortunate enough to have the sponsorship.
My husband's sponsored it, alhamdulillah, so that was fantastic on his behalf. And that's basically, he's actually been saying to me, because I think with life you go through these phases. Now lately I never had any airway. I don't recall having airway issues. I never used to be a snorer. Look, I started snoring after I met my husband. I think he's part of the problem, Zohra. I don't know if you can fix that. But yeah, it's only been a more recent thing. But I wonder if it has to do with, early in the COVID days. I was going through a lot of stress. Again, this is a bit personal on the podcast, but I was using a little bit of medicinal cannabis at that time. And I wonder, probably overusing actually. And I wonder if that
take a look at Zohra's face, right?
Yeah. I wonder.
She's like,
I might take this part out of the podcast.
We're leaving it in for
sure. It's a bit personal.
Yeah.
But I was using cannabis daily. And I just wonder, I never had airway issues that I recall before that. But it seems that ever since that time, snoring and oral muscular issues became more of an issue in my life.
Interesting.
And my family never used to complain about snoring. My ex-husband never told me I was a snorer.
How long was it though that you were doing it?
I was doing it every day for at least a year.
Okay.
Yeah, but then it damaged my voice box, so then I stopped.
How interesting. Okay.
Yeah, this is personal. And then, so obviously I'm not engaging in that sort of activity anymore, but I just wonder the impact that had on my airways, because I never had these issues as much as I did, now as I did before.
Yeah.
Very curious about it.
Good question. Honestly, I don't know too much about medicinal cannabis. I'll look into the research for you. This can be something that we can follow up after. But what we found is a lot of patients during COVID, we became hyper aware of our airways. So even though we did have something beforehand, there might have been some grade and age as well. As we get older, as we get into childbearing, our body's changing. We become more aware of these things that are already existent. I know now I'm in my late 30s. What would have bothered me now never bothered me before. So our bodies are changing, and that's why oftentimes we have those adults coming in later in their life as well, because now they're recognizing that those long-term, in the 20s, we're really good at working and surviving. We're really good at working around anything that's not balanced. In our teenage years, nothing bothers us. We're like superhuman. Then we get to our early 30s and we get to this sort of closer to where we think is middle age. And then we notice these changes. We notice that the impact that it's had long term has been a little bit, it's sort of like drops in the ocean, and now it's become too big to ignore. And especially during COVID time, because our immune systems were so sheltered, we were all, we were under lockdown. We were hyper aware of everything was happening. We were focusing on our airways because we were doing rat tests all the time. We were looking for symptoms. We were indoors, not getting enough, sunlight, not going outside. So a lot of those changes that we found, there was, and I'm not saying this is necessarily what happened with you, but a lot of the adults are becoming more hyper aware of the airways since that time because we were forced to.
I think a lot of people, they're doing the same thing with tiredness and complaining about, I've been tired since I took the vaccine. There's that kind of reaction. And I'm like, I bet before the vaccine, but it's almost validated because it's like, are you having these symptoms from the vaccine? And people talking about it now, it's like you're saying, they're becoming super aware of, yeah, I am actually tired. Yeah, it was since the vaccine. And I bet if they looked at their life prior to the vaccine, they were just as tired,
It's just
if not
because
if
yeah,
not
we
even
slowed
more
down.
tired. But I think sometimes we try to look for these links because it helps us to
I think
understand.
people were generally starting to focus a lot more inward towards their health during that time. Like I took my practice online during COVID, and I couldn't keep up with the amount of clinic work that I had because everyone was just kind of stuck at home thinking, all right, well, I'm struggling with all these issues. I might
Yeah.
as well sort it out. You know,
Want to
I
fix
want to
this.
support my body because, I don't want to, I don't know how it's going to respond or
Which
react.
is
I
a
don't want to
blessing.
get COVID. I want,
It
yeah.
was a blessing in disguise, but at the same time, yes, it made us be more present. It made us be more hyper aware of our health. But also, we were forced to slow down, which is so important. Oftentimes, if we're just doing the day-to-day grind, we're doing the same thing every single
We're not
day. We don't
noticing
pick
the
up,
little
yeah,
things.
we don't pick up on these issues. We don't pick up that something's not right. So when we slow down and we've got nothing else to do at home and nobody else to meet, and social life often distracts us with what's happening with our health. We, like I said, you're really good at compensating. Our bodies are really good at compensating. Then
Yeah.
when we're forced to slow down, which we really should be doing on a daily basis, we've got our salat, we've got our prayer that forces us to slow down and be
For
present.
those who pray, not everyone.
Yes, yes,
Not
yeah.
everyone's a Muslim.
And it's great, any kind of meditation to allow you daily to just stop and just take in what we're feeling with our body, focus on our breath work, dhikr and things like that help us work on our breath work, help us work on, really connecting with ourselves in the moment rather than being busy. So a lot of the time, and I'm not saying that the health issues didn't come up during COVID as well, that's completely valid as well, but we might find that during that time, we were given the opportunity to really focus on the present
Yeah.
and slow down a little bit.
I wonder if we looked at the rates of divorce after COVID as well. Did people then have a chance to reflect on their relationships and like, I'm actually in a terrible relationship because you had all this time together and sitting together and, spending time together and reflecting on your relationship. I reckon I'm going to look into that and see how many divorces post COVID. Was there a spike in that year after
You just
COVID?
need to look at how many home renovations happened because then we realized,
Yes.
actually, I don't like the color of that wall and I don't like that ceiling being that. So,
Yeah.
it was a blessing in disguise. A lot of health issues did come up during that time as well. Not to discount that, but yeah, definitely. It's one of those things that we need to be aware of when it started and why it would have started.
Before we move on to another topic, just quickly wanted to, I'm thinking it might be yes, but in your professional opinion, mouth breathers or people who are having, constantly breathing
I
from
feel
their
like
mouth.
they're targeted. Can we stop using that term?
Mouth breathers? I don't know. You guys use
Habitual,
that
yes,
term,
that's
so
okay.
I'm just using it.
Habitual mouth breathing, yes.
Do you know what? Because that's what my husband was saying to me the other day. He's like, "You've got a
Fire breather.
He said, "You've got a receding chin because of your mouth." I said, "Excuse me," and he's right. He's right. I just don't want to hear it.
Is it? I didn't even notice.
He reckons that my chin is.
Is
Yeah.
it?
Oh, Zahra's like, I reckon
We
it
call
is.
that something.
Have a look. Good turn to the side profile. I think
Yeah.
it's perfect.
Beautiful, gorgeous. But what we find, yes, so mouth, how is it all connected? If you want to know, ask his source. But how it's all connected is that, yes, if we don't have the tongue sitting up on the roof of the mouth, like we mentioned through mouth,
Yeah.
tongue sits low. We don't have that growth of the top jaw. The bottom jaw gets trapped. I'll try to get a good angle. Bottom jaw gets trapped under that top jaw. We're limiting growth. So then we
Yeah.
have the underdeveloped jaws of both top and bottom. So we don't really have the bottom jaw saying, oh, you're not growing properly, so I'm going to come out here. That doesn't happen. So the top jaw, then we have the crowded teeth are clinched together, and we have the crowding in the lower jaw, even if
I've
we
got a
have
bit of crowding teeth.
I've got a little bit of crowding in
Yeah,
my lower
I
yeah.
see that now.
Yeah. And it's
Okay.
because those teeth
Johnny Man
have
Day.
to shrink and they have to be,
Mm.
pushed in. The lower jaw has to be pushed in. And yes, you do get a recessed chin sort of profile if that top jaw hasn't grown to capacity. And this would have started from birth. This
See,
would have
my theory is it's not actually her mouth breathing, it's just because she talks too much.
been.
So, no, I wanted to ask about the gut microbiome. I assumed that because you're mouth breathing, I can only assume that the composition of the gut microbiome would change because you're constantly using your mouth.
Yes, yeah, potentially there is that link between the bacteria that exists in our mouth and the quality of bacteria and the quality of bacteria that's in our gut. So you can imagine the first entry to the rest of our body is our mouth. It's very rare that we would have anything else entering the rest of our body unless it's medicinal, unless it's, through absorption into the skin. The mouth is the first point that we will get anything that enters our body come through. So definitely the quality of research shows us the quality of the microbiome. So what is happening, the microscopic universe that is happening inside our mouth is going to be a reflection of what is happening in the rest of our body. So this, if we're mouth breathing and we do have that dry environment, not enough saliva to balance the pH, acidic environment, it's going to allow for the growth of those bacteria that thrive in the acidic environment.
Because it's constantly dry. Yeah. Got it.
I mean, the number one protective factor before we even get to
Saliva.
teeth, before we even talk about fluoridated water, before we even talk about toothpaste, the number one protective factor for our teeth is our saliva. So definitely we need to look at the quality of the saliva, the thickness of our saliva, and yet what are we doing to optimize its coating of our teeth and our gums?
Okay.
We're swallowing that saliva and goes into your gut.
Yeah.
It's a whole system, isn't it? I remember when I was speaking to my dentist about this, but I've done a bit of research on it too. But even just the importance of those small habits which are hard to keep up, but the pixters, the floss, like that bacteria that gets between those teeth, it gets so smart at thriving and living without that exposure to oxygen. So that was something that I learned even about flossing. It's not just about removing that physical sort of plaque, or even with pixter, like interdentals, it's about that bacteria being exposed to oxygen. And anyway, so I don't know if you've got anything you'd like to expand on that.
Yeah. Absolutely. It's a nice little segue as to why we even brush our teeth. I mean, it's such a big part of history. Humans, since the beginning of time, have been brushing their teeth. We've recognized the importance of keeping it clean, not just for social reasons, to have a nice looking smile or not have smelly breath. But as soon as we stop brushing our teeth, a biofilm starts building up on our teeth. And any moist surface. So we look at pipes, we look at water bottles, anywhere areas in your house. As soon as you have moisture and nutrients coupled with oxygen, sometimes there's no oxygen required either for anaerobic bacteria, we will have a biofilm forming. And a biofilm is just a structured, really thin, microscopic layer of microorganisms that come together and start forming a layer. Once they've built that layer, which pretty much is on our teeth all the time, and even more so at nighttime, that's why when we wake up in the morning, we have to brush our teeth before we have our breakfast, not after. But that biofilm then is the scaffolding for more bacteria to adhere to it. So the more that we leave that biofilm without disrupting, which is what brushing is. So brushing primarily with or without toothpaste is disrupting this biofilm. Because as we eat food, those nutrients from the food, the balance in the pH in our mouth, that aids those bacteria, the opportunistic bacteria that are bad germs that we call them. They build up then on our teeth, and that's what we feel eventually as plaque. So if you don't brush your teeth for a little while, a couple of hours, you'll feel a film over your teeth. That's just, colonies of bacteria that are stuck and adheres to that biofilm that have been opportunistic, and they're using the moisture, sort of the water content inside our mouth, plus the nutrients that it's in our food and in the saliva, and they produce acid. And then that acid is what causes holes in our teeth. So brushing primarily is to disrupt the biofilm and remove any bacteria that's building up on our teeth. Secondary to this is toothpaste application, which helps remineralize the teeth. So if we find that the bacteria have been around producing acid, the pH level in our mouth is altered, it takes about half an hour for our saliva to buffer that pH. So in that half an hour after eating, your teeth are the most vulnerable. So toothpaste helps to benefit that, because toothpaste helps to buffer that pH, but it also removes the microorganisms creating that acid. And that acid, what it does, it starts leaching the minerals from our enamel, our teeth. And that's why, long story short, that's why brushing our teeth is so important. It's really just to remove those bacteria or that biofilm that is going to lead towards the oral health diseases.
So then what would be the benefits of mouthwash in that case?
Yeah, so mouthwash can benefit in the way that it reduces the bacteria load. But unfortunately, a lot of the mouthwashes that traditionally we have used, which have alcohol, they've been linked to oral cancers. So we don't use mouthwashes with alcohol anymore. And any other mouthwash should be used for a limited time only. So any kind of disruption to the balance in our microbiome inside our mouth is going to do some harm. So even if we were to use toothpaste nonstop for about an hour, that's going to do more harm than good. So everything in moderation. Mouthwash, I would only recommend if you have gingivitis, so if you have bleeding, inflamed gums. Otherwise, saltwater rinses is the best thing that you can use. So you don't need anything medicated. It's free. It's in your cupboard. Using that saltwater rinses, bacteria don't really like salinic environments. They don't like the salt water. So that's going to help balance out the microbiomes in your mouth already without any need for over-the-counter mouthwashes.
So to reiterate, just for everyday people without gingivitis, mouthwash isn't needed.
No.
Okay.
Don't.
Okay. It's an important note.
I think largely because a lot of these mouthwashes are made of antibacterial ingredients or ingredients that kill. And that goes for, I'd love to just add that a lot of the natural sort of mouthwashes are trying to achieve a very similar
like
outcome.
oil, I think, based on and things like that. Yeah.
Yeah, that's what I find. Do you have any comments, since we're on the topic, about oil pulling? Because I know that, you know, we're speaking about this. My brain is firing with so many questions right now. But yeah, what is your perspective on oil pulling? Now, I know, like, you know, historically there's a huge traditional use there. I'm aware that there's like some sort of data, but I know that the research is quite limited in this space. But what is your sort of professional take on things like oil pulling?
Yeah, so oil pulling, just really quickly, is the swishing around of the oil in our mouth, like a tablespoon of oil for about 15 to 20 minutes. Traditionally, you would use coconut oil. At the moment, research is showing sesame oil is the most effective. So whether it's olive oil, coconut oil, just a natural oil that we use, swishing around for about 15 to 20 minutes, which is actually a very long time. If you think about it, you're looking around, you're just swishing. There are some benefits to oil pulling, but it will never replace toothbrushing. And it's pretty much in the same sphere as mouthwash. If you have a gingivitis, if you have gum disease, if you have that imbalance inside the mouth and you need a little bit of extra help, go for it. Use the oil pulling. There are also limitations to oil pulling as well. We're not going to be doing it multiple times a day, every day. We use it for a short period of time because also, like we mentioned before, having that oil in your mouth disrupts the balance of the oral microbiome as well. So if we're then having that in our mouth, which is not naturally supposed to be there, for a long period of time or extended period of 3-4 weeks, then what we're doing is more harm than good. We're not allowing the saliva to do its job. We're not allowing everything to balance out. So there is definitely space in the research. So definitely space in the research, but with limited use.
Such a good reminder to bring things back to basics in all areas of health, you know, not even just oral health, but in terms of our diet, our lifestyle. Just we're so, I think, just as a society, we're all constantly looking for that, you know, that quick fix or that thing that we saw online, or you know, what we can add to our routine. But there's so much that we're already not doing well enough at the foundation. And so nobody, it's not sexy to tell people just to brush and floss. No, you're going to add this and that, and it'll be best if you do all these things. But the thing is, you know, most of us are not, you know, doing the foundations. But
I think brushing and flossing in the dental world is the same as diet and exercise in the medical world. If we were doing that, you know, we would be able to manage things a lot better. So absolutely stick to the basics. When we do have instruction from your oral health provider to say, look, you need a little bit more help, take the natural recourses. So if you want to use the oil pulling over the mouthwashes that are over the counter, great. We have evidence to show that there is some benefit in that.
Yeah.
I would love to, sorry to interrupt.
I had something I wanted to say.
But what I have to say is more important.
I will go for it. Yeah. Just make it quick.
Yeah. Yes, sir. Yes, sir. Your thoughts on miswak then in this case?
Yeah, definitely. So miswak has both the metaphysical, so the spiritual benefits, as well as the physical. Because what miswak does is essentially disrupt the biofilm. It disrupts that plaque probability. It's just as effective as a plastic toothbrush.
But you don't have to use toothpaste because it has natural fluoride and minerals in it as well. So would you say it's better to use?
I would say yes, it is better to use miswak, although we are not very well versed, I think, as a general population on how to use the miswak and the proper storage of the miswak, for example, to avoid bacteria growth or mold growth on our miswak. The quality of the miswak that we're getting is often not as good as if we were in the country using, you know, in the pilu tree or the, you know, the other, to have the source of the miswak in the way that our predecessors used to do. Take it off the tree, let it dry out, very natural, very close. And having the minerals that existed in that area. So that tree is rooted in the soil of the minerals that exist in the area of those native people. So sometimes when we import, just like fruit and veggies and things like that, we're importing fruit in winter that doesn't belong in winter. You know, we're importing it because it's coming from someone else's summer. So in the same way, try to access local, number one. We're kind of digressing, but miswak for mine, it's going to disrupt the biofilm. It's going to disrupt the plaque buildup. And the Prophet ﷺ also did khilal. He also flossed. So
Yeah.
it would have been cotton at that time, cotton strings and things, but now we use, satin floss and things like that, nylon, and that's completely valid. So as long as we're getting some removal of food debris and plaque from our teeth and in between our teeth, doesn't matter what you do. But the miswak has the added benefit of getting the reward.
Yeah.
I'm glad you brought up the miswak.
I'm going to turn on the light here.
Yeah, turn it on. I actually, so, we often speak to clients a lot about oral health as it ties into, overall health and just, chronic health diseases and, overall health outcomes. And I actually had a company reach out to me a few months ago to send me their toothpaste, and they were wanting me to promote it. And it was a toothpaste where they added miswak powder. But I was quite hesitant about it because I thought, obviously traditional use of miswak was quite different. What sort of properties, what would be the clinical relevance or significance of, crushing a piece of miswak into a powder and putting it in a toothpaste in comparison to another toothpaste which has minerals in it. And I was very curious about that. And obviously that, you've explained what the benefits of using a miswak are. But would you agree that that's just a bit of BS marketing? Because that's sort of how I felt a little bit about it. And it wasn't like, obviously miswak has an extensive use, in Islamic sort of history and Middle Eastern and Middle Eastern cultures. And I just thought, this is like a Western brand, just adding miswak in there, in a powdered form. But what's your take on that? Because I was a bit hesitant. I didn't end up going ahead.
Yeah, so miswak, there are the natural benefits of using a miswak. There are minerals in the miswak, there are antibacterial properties of the miswak that allow for improvement in oral health. Whether you put that in a toothpaste or you just use miswak as a stick, I think the idea is to put it in a toothpaste to make it easily accessible for those who want to just use a normal looking toothbrush, but also want the benefits of the miswak. I think the image of walking around with a miswak might prompt to say, look, how do I use the miswak, look at the benefits of the miswak with the intention of following the sunnah without, using a stick that looks like a twig. So I think that's where those miswak toothpastes stem from. But at the same time, I mean, it wouldn't be any different from any other natural toothpaste either. It'll have all the properties that you need to help balance out the bacterial load in your mouth, a sense of detergent as well to remove any plaque and staining and things like that. So I wouldn't discount it, but at the same time, I wouldn't say that's the be all and end all and that's the only toothpaste that we should be using.
For sure. Yeah. It was quite an expensive product. So, I guess, for me, it's just, the weighing up of, other benefits outweigh, higher than using just another standard product. And like you said, removing the plaque is key, and remineralizing, even if that's with a normal toothpaste, is also key. But on the topic of toothpaste, let's talk about fluoride, because obviously fluoride is a very juicy topic. Everyone has an opinion about fluoride. There does feel that there are two distinct camps in this topic, and we don't have to go into fluoride in waterways and all of that, because I just feel like that's another topic completely. But fluoride in toothpaste, I'd love to hear, your reflections, a little bit about the sort of evidence, and what you also see clinically. Obviously, you work with people that are, brushing their teeth using different toothpaste. So what are some of your opinions in that space?
Yeah, so the main reason for using fluoride, why do we even use fluoride? Why do we even use toothpaste? Toothpaste, along with fluoride, has other benefits. So they have potassium nitrate if we've got sensitivity. They have the detergents in there, antibacterial properties. But the main benefit of having a toothpaste is it is a vehicle to carry fluoride to the teeth. Okay, so fluoride is a naturally occurring mineral, and what it pretty much does, it helps to sort of slow down the action of the bacteria in our mouth. So it actually helps to reduce caries or acid production for the bacteria, helps to remineralize the teeth. So it pops the building blocks back in the enamel once it's had some acid attack or erosion, and it helps to buffer the pH in our mouth, like I mentioned. So fluoride does have the added benefit. It does strengthen the enamel. So once it binds to the naturally occurring hydroxyapatite crystals in our enamel, it creates fluorohydroxyapatite, which is stronger than hydroxyapatite. So there's been decades of research to show benefits, topical benefits of fluoride use in toothpaste to benefit our oral health. And certainly I do see patients who have opted to go for the natural route and have fluoride, have toothpaste without fluoride. And unfortunately they are at a high risk of decay. And we do see it that often we say, look, even if it's not for long term, use it for short term just to help slow down the progress of the lesions, the decay in the mouth. So there has been no research to show, there's no definitive research to show any toxicity associated with fluoride. I know we've we want to link it to neurodevelopmental disorders. We want to link it to any kind of preterm births or premature births and things like that during pregnancy. There's no research to indicate that.
That is not
The greatest risk associated with fluoride ingestion or having too much fluoride in your system is fluorosis, which affects the enamel of the teeth. So at the end, the most harm that you'll do with too much fluoride, and this is really if we're swallowing mouthfuls of toothpaste, which really doesn't happen. But if we're having more than half the toothpaste tube and we're swallowing it, that's when we get fluorosis in our teeth, which is just a change in the development of the enamel as it's being put down and it's been developing in our bone, which strengthens the enamel. It actually makes the enamel stronger because once it disrupts the development of the enamel, your body does what it does and it strengthens those areas. But then we have discolored teeth. So what fluorosis is just whitening. It looks like white splotches of your teeth. Does it make it more prone? It's actually less prone to decay. But that is probably the main risk of using fluoride or using too much fluoride. But apart from that, we have fluoridated water. So 70% of adults will get their fluoride from water fluoridation. And the rest is if we ingest a little bit of toothpaste or if we're having fruit and vegetables as well that have been grown with water that is
fluoride. Yep, fluoridated.
Yep.
It's so crazy to me, just the fear mongering about fluoride. And, all these decades of research showing fluoride is beneficial. No one's telling you to swallow it if you don't, it just in terms of, the benefit that it has on our teeth and our teeth absorbing it. And just crazy to me how that misinformation spreads so wildly. And again, also, I think for me, working with neurodivergent families and, people impacted by disability, like this affects them the most. And often they are seeing misinformation floating online that, fluoride is causing all these neurodevelopmental issues or, storing itself in the brain. And it's just, it's so sad that families have to constantly trying to combat this information online when, the benefit, this is clearly a situation where benefits outweigh risks. And even you've explored what the risks are, and the risks are not necessarily as what people would think they are, based on what they've been reading.
Yeah, it's really important to be critical of what we put in our bodies. I think it shouldn't discount the fact that we should take ownership of what we're putting in, bringing inside our house, what we're giving to our
100%.
children, what we're exposing our family to. But research after research has tried to prove toxicity levels of fluoride in terms of brain health and heart health and organ health. There's just not been enough evidence to support that.
Yeah, thank you so much, Zohra, for breaking that down for our listeners. I'm curious about, so you mentioned that people that are using, say, toothpaste that don't have fluoride, there's not necessarily that protection there in terms of tooth decay. Have you ever noticed that there was more of an increase sort of in cavities in people that are not even just alone brushing, but using non-fluoridated fluoridated tooth?
Fluoridated, yes. Yes. Yeah, we do see a correlation, unfortunately, but we also have to understand the process of decay, tooth decay. It's
All
not
the factors.
there's so many factors. So you could be using fluoridated toothpaste twice a day religiously and still have holes, and that's because tooth decay is the #1 preventable disease worldwide, but it's also multifactorial. So there's definitely the plaque removal is going to be key, but diet comes into it as well. So you could be really good with fluoridated toothpaste if your diet is high in acids, sugars, and starches, which promote dental caries or gum disease, then we're not going to be doing the most that we can for our teeth. And likewise, if we are not using a fluoridated toothpaste, but we have a very balanced diet, not high in processed sugars and processed, complex high carbohydrates like sugars and starches, we're not having acidic drinks like lemon water, apple cider vinegar first thing in the morning, black coffee can be quite acidic. And often I find that if we have issues with, for example, using fluoride, then we should be looking at caffeine as well. So caffeine we know is associated with low birth rate for children if mums drink caffeine. And we are avid tea drinkers. I think all around the world, we love our black tea, we love our green tea, we love our coffee. So if we are going to be critical of things that we're putting in our body, we need to be quite balanced in the way that we do it. But yes, diet definitely comes into play. How we're brushing as well. Even if we're brushing with fluoridated toothpaste, but we don't know how to brush properly, or we're just doing the front teeth, not the back teeth, we're not flossing, getting rid of things in between the teeth, we're still going to be at risk. So definitely not as simple as, no fluoride equals decay or fluoride equals no decay. It's multifactorial, and to be able to approach it in that way just means that we can provide and meet the patients where they're at. If someone just genuinely doesn't want to use fluoride, absolutely, I can support that. Let's come in, let's teach you how to brush properly. Let's see what is happening then that we can, boost our other efforts in terms of oral health if we don't reuse the fluoride. And that's really, I think it's important to meet a patient where they're at, and it's probably the same in your professions as well. If you want success for a patient, you genuinely meet them where they're at, not just where you think they need to be. And there's a lot of social determinants of health as well. It's finances. Maybe you can't afford the Colgate toothpaste and the best that we can do is buy cup soda at home. Maybe we can't afford a good toothbrush. Maybe we can't change it every 3 months. Maybe, these things are beyond, I'm struggling to keep my family together, or I'm struggling to keep a job down, or, migrants and refugees. They have so many more important things to worry about than oral health. And that all needs to come in when we're trying to be empathetic healthcare providers, that we don't just talk, it's sort of like bashing them with toothbrush and floss and fluoridated toothpaste. There's a lot that goes into being a health professional, and yeah, definitely
being aware of our privileges and any ableism that maybe might show up in the way that we show up for clients.
Did you say caffeine and fertility? Did you want to have another baby, or should I take
Thank you. For me, that reigns a lot of truth, especially for when I was pregnant. I struggled. I had the best oral hygiene routine, and then I got pregnant, and then the morning sickness, the vomiting, the nausea, and then I have struggled actually to create that consistency ever since being pregnant. And so, that was, I guess a time where it became very difficult for me to, access a lot of the things that I knew worked and were helpful. And even though my dentist was like, please keep trying to brush, I was like, every time I brush, I gag and I vomit. So, so,
it's not going to happen. Yeah,
exactly. But, you on the topic of pregnancy, I'm very curious about the impact of pregnancy and pregnancy hormones and all these nutritional changes during pregnancy, and how that might impact, gum health, to oral health, and tooth decay. Because I've noticed personally with myself, I know for a fact my gums are not where they used to be pre-pregnancy, as opposed to now postpartum. And I know that's multifactorial. I know that, for a lot of the reasons you've mentioned in terms of removal of plaque, and I am consuming more, I'd say, beverages and foods that maybe I wasn't consuming as much before, that are having an impact on the teeth. But is there any more of a connection as well in terms of, can we talk to the hormonal changes, or obviously nutritional demands during pregnancy, how that impacts teeth?
And also, to add to that, I've heard that women their teeth can fall out during pregnancy. Is there any truth to that?
Yeah, sort of like A plus B plus C equals tooth loss. Not necessarily that you're pregnant and your teeth will just start falling out, but definitely because of the oral changes that we find during pregnancy. So it has been shown in research time and time again that the hormonal changes that we experience during pregnancy, because our immune system needs to tone it down. We want to make sure that the body accepts this new fetus, accepts the embryo. So our immune system when we're pregnant does reduce. In that way, we have increased inflammation around the body, and definitely the mouth is not excluded from that. So we see a higher instance of gum disease, higher instance of gingivitis, which is just inflammation of your gums. We find that during pregnancy, exactly like you mentioned, our diet changes, our oral health habits, our exercise routine changes, our sleeping habits change as well. So all of those things lend to our oral health being at a higher risk during pregnancy than if we weren't pregnant. And certainly being able to access dental care. So we have patients who are pregnant, can't lie down all the way in the chair. If they come in for an emergency and they do have morning sickness and they have nausea or they have reflux, it's a very uncomfortable situation for them. Oftentimes there are certain anesthetics that we can't use during later stages of pregnancy because there is a risk of a miscarriage, because there's a risk of bringing on labor. And it's a very specific niche anesthetic. Don't want to scare everybody. But x-rays, we want to avoid x-rays, at certain times, especially if it's a bigger x-rays. Smaller x-rays during pregnancy, there's no harm because it's very focused. It's not near the fetus or developing fetus. But a lot of the times we find that because our hormonal changes plus our habit change during pregnancy, then we see that the oral health is at a greater risk. Yes.
So it's not so just to clarify, there is no chance that just because you're pregnant, your teeth start falling out.
No. So the chance
Because I know everything gets loose and you got relaxin, increase of relaxin, so everything becomes relaxed
yes.
as such.
But if that was, imagine all of us would have teeth falling out.
Yeah, but
if it was
I know,
black
but
and white,
but it would impact people different because, like, for example, in my case, like you hear foot sizes gets bigger, so your foot
Yeah.
relaxes and then it just doesn't go back to its previous shape. So I was just thinking, logically, it can happen. I don't know, it can get loose around your teeth, and you're. I don't know. I heard it and it scared me. Okay.
Luckily, our teeth are not just in our skull through connective tissue.
Yes. Yeah.
Also, it's embedded in,
Nerves and all that.
so
Yeah.
no matter how much sort of relaxin we have flowing through our body, the bone
Oh,
is going to be
scary.
affected. But what we find is the A plus B plus C equals tooth loss during pregnancy is that we have poor oral hygiene. And I say poor with a lot of empathy. We have altered oral hygiene habits, so we can't brush, we're going to gag. We have morning sickness, so we have a lot of acid in our mouth as well. So if we're bringing up, we get a lot of erosion. We have the teeth a higher risk of decay because the mouth changes. But what we find is that inflammation of the gums, can't brush properly. Everything that we put in our mouth, like toothpaste, makes us gag. So we avoid toothpaste. We can't floss because fingers in the mouth makes us uncomfortable. Or generally, we might have other health issues. We might have, gestational diabetes might be even played.
Yep.
Have increased blood sugar in and around the gums and around our teeth, so higher risk of root caries or decay around the gum line as well is increased during pregnancy. So what we find is during that time when we're not eating right, we can't brush our teeth and look after our oral health because we've got more demanding things. Often there's other children, there's still a household to run, and you're looking after your health. Your sleep is not great. We can't even caffeinate properly, so we can't even rely on that. So what we find is 9 months is a very long time to neglect our oral health. So we start getting inflammation of our gums. We have that gingivitis starts developing after not brushing for 3 days. So you won't get gingivitis straight away. If you have poor oral hygiene for 3 days, that's when we start seeing bleeding gums and things. So oftentimes if a patient comes into the dental surgery and they've got bleeding gums, this has already been a few weeks of plaque and things sitting around the gums. So definitely that's why number one, we look for bleeding gums. The hormones don't help because we have the altered hormones as well. So you're pretty much working against your body, trying to stop it from, causing more problems for you. So, and then that's the B and the C, and it equals to potentially holes in the teeth because of the changes in our habits, holes in our teeth because of change of diet. We often go for the foods that are not the most healthiest because that's the only thing we can handle, and often not being able to brush properly. So then we can potentially lose 1 or 2 teeth, not the whole.
I'd love to mention
Thankfully.
as well that like most women in pregnancy don't get enough calcium. And obviously we know that, calcium has an impact on teeth too. And then, so I find especially when I'm working with pregnant women, like 90% are not meeting their calcium requirements. So and their vitamin D is usually deficient too. So I'm always aware of, just how that will have an impact on teeth longer term as well. And just given that, so much of those minerals are going to baby to grow and develop this fetus.
While we're on minerals, just quickly before we move on again, you mentioned remineralization, so that's why we use toothpaste with fluoride. Is there other ways to remineralize your teeth?
Yes, so there are natural hydroxyapatite, like we mentioned, is a natural occurring mineral in the enamel. That's what our enamel is mostly made of. And there's biomimetic hydroxyapatite. So we can source that from plants and animals to help put that in toothpaste. There's hydroxyapatite toothpastes now that don't have fluoride and have the hydroxyapatite. That is an alternative. There's a lot of research coming through. I mean, that's been used in orthopedics, hydroxyapatite, because it's also in our bones. Has been used in orthopedics for decades. Dental is now becoming more mainstream for us to use hydroxyapatite, but it's just that fluoride has been so effective and with such minimal side effects that we haven't needed to replace fluoride up until now. But now it's always good. I mean, if there's alternatives, great, because what happens when we don't want to use fluoride anymore, then we have the hydroxyapatites. There's natural remineralization of calcium and phosphate. So there are, for example, tooth mousse. It's pretty much a remineralizing mousse that you put. It's like a gel that you put on your teeth. We recommend that here. And it has calcium and phosphate. You can get the one that has calcium and phosphate by itself or with added fluoride for added benefit, but we can use those minerals to help because they naturally occur in the enamel as well. What we're doing is those building blocks. So imagine a brick wall, you have acid attack on your teeth, some bricks are missing. We can use multiple things to help remineralize and strengthen the enamel. And remember, enamel is stronger than bone. It's the strongest component in your body. So if any this bacteria is able to produce acid and break down your enamel, imagine what it's doing for the rest of your body. And surely the systemic issues related to, and we're probably going to get to that, so I'll jump in now. But systemically as well, the bacteria that is existing in our mouth and in our gums, the bad bacteria that causes gum disease and decay, that's been found in patients in their hearts or bloodstream of patients with heart disease, patients who have strokes, patients with Alzheimer's. Because what we find is these bacteria, they're not ideal. And through the gums, they get into the bloodstream. They cause inflammation in these different sites around the body. And inflammation around the body is when we get sort of that imbalance and we get diseases forming.
Yeah. And there is that, I don't know much or too much about it, but I hear people talking about it, is not to get, if you have not to get a root canal for that very reason, because it's kind of allowing more bacteria to travel down. I don't know how much truth there is to that, but there's been a fear around getting root canals, and do not get a root canal. So
I think root canals are the new fluoride. It's the new thing that we like to hate. Unfortunately, we love to hate something. Root canals have always been a form of removing infection from the body. So why do we even do root canals? So the tooth is made up of the hard structure of the tooth, and then it's got the pulp, which is blood vessels, the nerve supply, which is in the middle of the tooth, and the nerve runs through the roots of the tooth. Why do we even need to do a root canal is when we have decay that progresses into the second layer of the tooth and gets into the pulp, that bacteria infects the pulp, which is the nerve supply and the blood supply of the tooth, and creates an infection. That's why we get an abscess on the gum, we get fever, that's when the tooth hurts quite a bit, to hot and cold, whatever it is. So once we get to that point, that you cannot revive or you cannot heal the pulp of a tooth, unfortunately.
Can't save
figure that out. You can't save the tooth. The only way that you can save the tooth, the structure of the tooth, and keep it in the bone is to remove the infected pulp. Is to remove the infected tissue that's inside the pulp. And that's what essentially a root canal is. So they go in, they drill like they would for a filling. We remove that infected pulp, clean out with an antibacterial agent, cleaning out those pulp chambers so that we don't have any bacteria or any of the infection remaining. Now, a lot of the time and throughout the history of endodontics, this has been the main way that we will save a tooth once it's infected. Because as dental health professionals, our ultimate goal is to save the teeth in the bone. We're not trigger happy. We don't take out teeth as soon as they become a little bit sensitive, they become a problem. Because as soon as we take out teeth, that changes our bite. It affects our function. It affects our speech. It will affect long-term as well. We don't want to be having dentures and implants because dentures and implants will never replace your natural teeth. They will never be accepted in the body and be used in your mouth as your natural teeth would. So our number one goal, save your teeth. And we're going to do as many steps as we can to get to that point. And root canals have never been linked with breast cancer. I know that's coming out. The research for that one that came out in a documentary, that's been debunked. It's not been linked with any other systemic issues because the point of a root canal is actually to remove infection, not introduce it. So if we're having introduction of that infection from the root canal into the bloodstream, it's not the root canal that did it, it's the decay that was in that tooth that already introduced it in the bloodstream, and it's almost too far gone. So we're trying to prevent from things becoming worse, correct? And none of the materials that we use inside the tooth for the root canal have any adverse effect. They're all biocompatible, and the research has shown over and over again that root canals in themselves do not cause these issues. It's the infected tooth. So you've got two choices when the tooth is infected, either root canal, so we can save the tooth and save the space and avoid bone loss, because once the tooth is gone, bone dissolves, doesn't need to be holding anything. So then we have changes in how our face is shape as well. So if we lose teeth at the front around here, we have that sunken lines. We have, the change of our face. We get the collapse of the jaw. So definitely there's a lot more risk in losing the tooth than there is in doing it.
Good to clear up.
Voice of reason is just
probably too technical for
it's
a
too
lot of people zoned out, but basically just
people don't want to hear reason.
Yeah.
They're like the hysteria. They're like the chaos of like something to blame, you know?
Well,
So much easier.
I think, you know, like Zohra, like we were chatting about earlier, it's great to want to do different things and to want to take a route that feels more aligned to your values. Like, you know, when I say that, I mean like the natural route, but
Hmm.
it's important to do what's safe and what's best for your body. And what's going to provide you the best outcomes. And, you know, if keeping the tooth there because you don't want to remove the tooth because of fear of what could happen and what will you face if you keep the infected tooth there. So I think it's just being able to really weigh up the pros and the cons of any intervention and look at how that impacts your life. And a lot of people will struggle to do that on their own, and I think
Yeah.
that's where professionals like yourself and having a really good dental team is going to be really helpful in ascertaining what's the best option for them. And I know Miriam was also curious about just on the topic of saving teeth, and people are also very curious, I think, about cavities and about reversing cavities naturally. And I know that, you know, in the past a lot of cavities were filled with like mercury fillings, and we've moved past that and we're doing things differently these days. So can you just touch on that a little bit? We're going to wrap up soon, but I'd love to hear your reflections on that.
And if cavities are contagious.
I've never
Yes,
heard that one before. Oh, that's
They
interesting.
cavities.
are. They are contagious, just so you
Yeah.
know.
I'll cover that one because
Yeah.
that's cool. Cavities are contagious. So in the way that a parent can pass on the bacteria that cause the cavities onto their child through sharing a spoon, through sharing a straw. In the same way, bacteria that causes gum disease is also contagious. So if you've got a partner who has gum disease, you're going to get it. If you've got a parent who has gum disease, you're
No
going to
kissing. No kissing.
That's wild.
buzz these bacteria. It's just like it's in effect. Imagine a virus. You've got the cold. You're going to pass it on because of the transfer of those microbes to the other person. In the same way, it can happen through contact of the saliva, which house those bacteria. And if it gets, you know, the bacterial load increases enough, then you will have those oral symptoms
That's
of the
crazy.
disease. Yeah. And in terms of reversing cavities, so to a certain extent, yes, you can reverse cavities because when we have the initial stages of decay, so they're demineralization, when you have the acid attack on the teeth, bacteria has gotten a good hold, they're not budging, we're not brushing them, we're leaving them for weeks on the teeth, then we get the demineralization. So these building blocks, the enamel starts dissolving. You get that demineralization. So if we don't have that remineralization process, or we're not balancing out the acid that these bacteria are providing through our diet, so we're giving them more acidic foods, we're eating more acidic foods and more sugars to strengthen these bacteria, then what happens is that lesion, that initial demineralization, it develops to become a bigger lesion, and a bigger lesion, and it travels deeper into the tooth. So if it's in the first layer of the tooth, we can remineralize, we can stop it progressing. The second layer of the tooth, which is not enamel, it's dentine, it is more organic and it has a lot of collagen and a lot of water. So decay travels quite fast. And it's so much harder for us to reach because once it's reached the second layer of the tooth, you can no longer clear the bacteria with your toothbrush. Your toothbrush doesn't get into the second layer of tooth unless you've got an open cavity, right? So even within the first third of the second layer of the tooth, we can remineralize, we can slow down the progress of that decay. After that, unfortunately, we're going to have to cut out the sick part of the tooth, the demineralized part of the tooth, and replace it with a filling material that either has a remineralizing agent or an antibacterial agent. So sometimes, yes, we will use a amalgam filling traditionally, so silver filling. They are great. We don't use them anymore, but they last 30 years, 30, 40 years. They do not budge. All right, they're very good material, but because they were not aesthetically pleasing because of the mercury content, we've moved to more tooth colored filling materials, which are the composite
Right.
resins and the
Yeah.
glass ionomer cements. Now, what we can use to remineralize or slow down the process of decay is fluoride. We can also use silver. So there's some products that use silver because silver is a natural antibacterial.
Antibacterial. Yeah.
Yeah, with or without the fluoride. But at the most, we can use at the least, we can use the fluoridated toothpaste or tooth mousse. So the calcium and phosphate to help slow down, or you can't really reverse, but to slow down the progress of those decayed lesions. But once we get too far, the only way that you're going to remove that decay and stop it from progressing into a root canal is through a filling. And that's why we always say
Fascinating.
minimal intervention, do the
That's
little that you
fascinating.
need to until it gets too far, and then you have to intervene a little bit more.
Like silver as an antibacterial. That's
You didn't
fascinating.
know silver was an antibacterial.
I knew we used it in wound dressings. So
Yes,
when I was a nurse, we used to
yeah.
do. But it's still fascinating. It's silver. It's fascinating.
Colloidal silver is
Like, it's
often
crazy.
used a lot for topical sort of. I used to work in retail, so we used to recommend that a lot for topical infections. But some people that wanted to take it internally because they love to do things
to the tooth
risky.
to remove.
So some people used to swallow colloidal silver. But yeah, we used to recommend it in retail all the time. But I never actually contemplated the idea of maybe gargling with something like that.
Silver.
But again, like you said, not something you would want to do every day or every meal, because again, that delicate microbiome, we want to protect it as well. It's just finding the balance. I have two more questions and then I think we're going to wrap up. We've spoken so much about so many factors today, and we've spoken a lot about diet and acidic foods. Obviously, we're both drinking very acidic coffees right now. What are your views on drinking things through a straw? Is it worth it? Do you recommend this to protect the teeth?
Yes, but I feel like most of the foods that we want to eat is to taste it. So drinking through the straw does kind of take the edge off tasting your food, which I would say is some of the best things of life is being able to taste food. I think we all learned that through COVID, that if we can't taste food, it's your quality of life does.
Takes the pleasure. Yep, out of it.
Look, acidic drinks, yes, drink through a straw, but for the most part, you're only protecting the front teeth. You're still going to get the impact of those food at the back teeth, and you're still altering your saliva. You're still altering what goes in your tummy is eventually coming through the rest of your body as well. So it's not just what stays in and around your mouth, but what is being ingested. So our diet as a general rule should be balanced, and our diet should avoid things that are, not going to be ideal for, from a nutrition perspective. Drinking through the straw, great, but a lot of the time that's not always the best case. So what I would say is drink what you want to drink, acidic or not, whatever it is, staining, but rinse with water after. No brush, but rinse with water. That balances out the pH, it reduces the acidity, clears out any extra food. Hot water is even better.
Yeah.
You can. But there are always ways to help reduce, the effects of what we're eating. What we like to say, especially for the younger kids in our clinic, there's no good or bad foods. There's foods that are sometimes foods, and there are foods that are all the time. Yeah. So just not shaming as well on diet choices. So a lot of the times we find that any time that healthcare is rooted in shame, it's not going to be effective long term. Patients are going to get burnt out. And there's just not, again, meeting the patient where they're at. So a good health professional will be able to see you and ask you. So we do diet diaries. We ask patients how they're brushing their teeth, how often. Do you have sports? Are you a shift worker? Because all of that affects how we look after our oral health and general health. So once we have all of that information, we take a proper history, then we're able to say, look, you're not able to really do mouth rinses all the time, or you don't want to use fluoride, here's some alternatives for you. Or, you love your sports drinks because you play soccer, 3 times a week, you love your sports drink, not great for your teeth, but rinse with water straight after. Or yes, drink through a straw. So just being able to say, look, having a balanced approach is really important with anything, I think, with health. And if you're able to find a healthcare provider who's able to provide that for you, then most of the work is done.
Zohra,
yes.
What's your take on teeth whitening? And is there any natural alternatives you recommend for teeth whitening? I know that's a hot topic with everyone.
There are natural
coffee drinkers, because starting to get yellow teeth here.
Yeah. So tooth whitening, there are natural alternatives to tooth whitening. We have found that hydrogen peroxide. Okay. So tooth whitening, you typically in the dental chair uses hydrogen peroxide, which is bleach. Essentially, it's not your bathroom bleach. It's obviously made to be compatible with your oral health. But it's hydrogen peroxide. What it does, it goes through to the second layer of the tooth. It oxygenates, there's oxygenation that happens, lifts up the stains, and it whitens the teeth. So what we're doing is getting into the tooth. Most of the discoloration of the teeth, if it's from drinking, coffee stains, and food that we eat, that's all superficial, can be removed with toothpaste or a clean from your dentist. But when we need to do tooth whitening is when the second layer of the tooth is shining through. So your first layer of the tooth is actually see-through, doesn't have any color. It's the second layer of the tooth shining through, which everyone's is different. So there's no ideal tooth color. The second layer of the tooth that's shining through is what we aim to whiten. So if we find that the top layer of our tooth, which reflects the light and doesn't allow the second layer to be shown so much, is thinning out because we're having acidic drinks and acid erosion on teeth, that's how our teeth get yellower as we age. or if we're having lots of coffee, if we're having lots of acidic drinks, things like that. That's why our teeth yellow, not necessarily because we're having those external staining.
Yeah, okay.
There are definitely research to show that there are natural whiteners aside from the hydrogen peroxide. There's been like banana peel, turmeric, things like that. Limited evidence to show how effective they are, and certainly it's just so much harder to find these things and find it in a way that helps.
There's a lot of bicarb toothpaste as well.
Yep, bicarb toothpaste unfortunately are very erosive to the teeth. So yes, it might
that's probably the way
whiten
it
the teeth.
works. Yeah.
Yeah. It might whiten the teeth, but we're also doing damage, which ultimately
I think would charcoal be the same? Is it just about
yeah.
Okay.
Charcoal is very abrasive. So any charcoal toothpastes, even if it's not for whitening purposes, but charcoal toothpaste, we wouldn't recommend that at
Would
all.
hydrogen peroxide cause sensitivity?
It can. So through the whitening process, through that oxygenation, the main reason that we get that sensitivity is dehydration of the second layer of the tooth. So like we mentioned, there's a lot of water in the second layer of the tooth. So sensitivity is essentially the changing in the pressure in the tooth or the sensitivity or the dehydration of that second layer of the tooth. So we can use fluoridated toothpaste, calcium, we can use calcium or phosphate to help push that back, kind of avoid the sensitivity, or potassium nitrate, which is in sensitive toothpaste. But there are no physical risks of using tooth whitening, whether it's in chair or take home, compared to anything else that we would use. So I always say, if you're worried about your teeth whitening, if you drink coffee or you drink orange juice or any kind of fruit juice, you're doing just as much, or no damage, I should say, to your teeth. So if we're okay with putting those things and having those come into contact with our teeth on a daily basis, whitening your teeth is not an issue.
I tried to whiten my teeth before I got married at the start of COVID, but the sensitivity was so much.
Your teeth are all right though, Sean. Like they're not.
Yeah, but they've definitely they're starting to yellow more because my coffee intake since becoming a parent has exponentially increased. So, so it's definitely something that I'm aware of. But the sensitivity, like they made my teeth felt very sensitive as I stopped very early on. And it was a take-home kit from a doctor. From a dentist. So it wasn't like. Because I know there's a lot of clinics now that are offering like dental whitening and there's products you can buy online. There's the High Smile. There's this dental space has become very saturated. And you know, Miriam asked you about activated charcoal and oil pulling and all these products, and there's so many products out there, and there's it almost feels like
everyone's
there needs to
obsessed with getting white teeth.
Yeah, but there needs to be more regulation, I feel, because there's so many products out there and you think, oh, that looks like a really good option, I should try that. But there's no information about what the risks might be. And I know from when I worked in retail, we used to sell activated charcoal toothpaste. We used to sell, the bicarb whitening toothpaste from Moo Good, all these different brands. And there's not really a good understanding or awareness around some of the risks. And I just think, that there needs to be more regulation, I think, in the dental product or manufacturing space, because I think there's obviously products out there that can cause harm that are sold with the slogans that this is going to be amazing for your health.
And there's no side effects.
And I think that a lot of it is driven, this is my perspective, but a lot of it is driven by the fear of fluoride too. This is a fluoride-free product and this is what we've added to it. We've added the charcoal, or we've added probiotics, or we've added this and we've added that. And I think it's just so overwhelming for consumers, I think, out there just trying to look after their teeth. They're like, what do I buy? What do I do?
Yeah, big pharma gets a bad rap because, yes, a lot of the time they're in it for the money. That's why we can't just have the generic brand. We have to have so many brands. But natural medicines and natural
wellness,
wellness, $1 trillion business as well. So it's not like they're not in it for the money either. At the same time, all of these products are there to help somebody. So if it doesn't suit you, stay away, take professional advice all the time. There are regulations, but unfortunately there's also loopholes for every regulation. So they might be able to label it as natural, even though it has the risks. Whitening, you can only get up to a certain percentage over the counter. Otherwise, a professional has to administer it. So there are regulation, but there's always going to be anyone who wants to make money or sell a product. They will find ways around it. And we just have to be smart, savvy shoppers and just ask a professional.
100%.
I wonder, this is totally unrelated. I can cut this out if you want as well. But I wonder if there was like a vaccine, or is there a vaccine for gingivitis? And if there was, would you tell people to take it?
Oh, interesting. So vaccine is inoculating the body, getting it prepared for an influx of any kind of virus, right?
Yeah.
The problem with that is that we all naturally have those bacteria that cause gum disease or cause decay naturally occurring in our mouth. It's only when they become over a certain amount that it becomes a disease.
Yeah.
It's no different than H. pylori, for example. It's just a natural. It's a natural part of our ecosystem in the gut. But then, for in different cases and different people, you get an overgrowth, and that causes symptoms. But there wouldn't be a vaccine or a pill that you take for H. pylori. I wouldn't view it in any different way. This is just my take.
I think the trick with that one is, how do you isolate bacteria like the ones that cause gum disease and tooth decay from other bacteria that naturally should occur in our mouth? So it's really having that
So there's not one linked bacteria like H. pylori.
No, there's not.
You've got broad spectrum antibacterials, but then you've also got those ones that will disrupt your natural and sort of probiotic capacity. So in the same way, it's very tricky to then just say just the ones, and there's three main ones that we want to target in terms of tooth decay and oral health diseases. How do you target those with a vaccine and not disrupt and disrupt the balance that is existing within our body?
This is a good discussion, because it was going to segue into my last question for our episode today. There is oral microbiome testing out there. I don't know if you're aware of that sort of testing. It's not something that I've ever used in practice, and it's not something that I intend to use in my practice, because I just don't feel that within my scope it's something that is worth having, exploring with a client, but also having them pay for. When obviously all these factors we've discussed, I know, are going to have positive outcomes, and I don't necessarily see the clinical relevance of this sort of testing. But I'd love to hear your views about this. Is this something that you guys use in practice? Is this something that you are a fan of? And I have recommended certain types of oral probiotics in my practice, and I use oral probiotics for myself. But I'm curious about your take on oral microbiome testing, because I think it is still an emerging space, and I have mixed views about it. But I'd love to hear from you. Obviously, this is your bread and butter.
Yeah, I've definitely worked in a practice that did do microbiome testing. So there's saliva testing. You can check your pH, just your neutral pH. But then there's a oral microbiome testing. So we had a microscope set up. We would take a swab of the plaque that's existing in the patient's mouth, and we'd look at it under a microscope, and we'd see how many of those bad bacteria there would be in there, how much of the good bacteria, how many blood cells and things like that. So I have definitely used it in practice, but what I find though is that its effectiveness is very limited, because if you are waiting to see the bacteria that causes your gum disease under a microscope, there's not much else convincing that we can do. Oftentimes, we just need to have the symptoms inside the mouth, just show the reaction of your gums, show the reaction, holes in your teeth. We take a lot of intraoral photos. So we have a camera that we can take photos of the surfaces of your enamel, how your gums are looking. And that's often quite effective in helping patients drive their oral habits in a positive way. So definitely, you know what, we can have so many nice gadgets and things in the clinic, but it all comes down to basics. If we cover the basics, we won't need to go that far.
Yeah. And what's going to impact your treatment, really.
Exactly. Because that's the crux of any sort of diagnostic tool or feature. And that's the same thing that GPs will tell you. If a test doesn't change their treatment outcome, they're very unlikely to run it, and that's, I don't practice very differently in my own practice, in terms of, I won't get someone to pay a lot of money for a test if the advice is not going to change. And I think it's very similar in terms of what you do. Like, you're already going to be telling people about how to manage, signs of, bacterial overgrowth or gingivitis or gum disease, or issues relating to bacteria not being removed, from the teeth. So anyway, this was an amazing discussion. We talked about so many great things.
Didn't even need that.
I learned a lot. I actually learned a lot myself. I can't believe that bacteria that cause cavities are contagious. I bet not. My husband.
That's why your husband doesn't kiss you.
My husband doesn't listen.
No, you got gingivitis.
Doesn't
don't.
listen to the podcast routinely, so that's fine.
Yeah.
But yeah, I'm very curious about that now, and not even just in terms of my husband, but even for children, like sharing spoons, sharing cups, sharing glasses, sharing straws.
Cleaning a dummy,
like taking it out and putting it.
Wild. Oh my God! Sorry, I actually have one last question.
Yeah, go for it.
Yeah, it's about kids.
Yes.
Toothpaste for children. So my daughter's 16 months. I try to brush her teeth at least once a day. that's the average. But I understand that, from about a year and a half, you can introduce toothpaste. So I would love to know about toothpaste with kids. Are there any recommendations? Obviously, there's swallow risks. So, what advice do you have in that space?
Yeah. So like we mentioned before, 70% of an adult's fluoride intake is through our water, fruit and veggies and the food that we're eating. For children, 80% of it is the toothpaste that they're swallowing. So a lot of the fluoride is being ingested for children because they maybe haven't learned the capacity to spit out everything. Also, they can't gargle the water to rinse out. So what we're finding is toothpastes for children, you wouldn't really need any toothpaste for children unless they're high risk of decay until they're over 2 years old. And that's because all of the final baby tooth comes through around 2 years old. Until then, just a wet toothbrush is the best thing and the only thing that you really need to use. Okay, clearing plaque. Yep, and making sure they're not sleeping with a milk bottle, not sleeping with any milk that might be pulling on those front teeth, as that's how we get early childhood caries. A lot of milk has high sugar content, whether it's breast milk, sort of cow's milk. Then we need to just make sure, even with a cloth, if they're too young for a toothbrush, and kids combat the toothbrush quite a bit. So even with a washcloth on your finger, rub their teeth. So that disruption of the bite, removing plaque is all you need to do at that stage. As they're getting a little bit older, 3 years old, 4 years old, there are over-the-counter kids toothpaste, which has a lower fluoride content than adults. So an adult toothpaste would have 1,000 to 1,200 parts per million of fluoride, whereas children's will have about 500 parts per million. What research shows is 500 parts per million parts. That's not a lot. In children, toothpaste is not as effective. It's not really effective. So what we need to be using is regular toothpaste, but just a smear. So the tiniest bit, we're just putting a thin coating on the toothbrush, just enough to see. We're not doing a pea size amount by any means. Adults, we don't need the whole toothbrush even covered by fluoride either. Just a smear of toothpaste is enough for a child to get the amount of fluoride that they need to protect their teeth.
Amazing. And just as a flow on from that, do you have any advice about we're going to wrap up because this is a long episode.
No, my boys, they're getting rowdy. They're
like, hurry up, Mum.
Hurry up, Mum. It's been a long time. Listen,
go for it. Sorry.
Last question. Any advice about healthy ways to encourage children around teeth brushing? Because I definitely find, like, even for me at the moment, it's a bit of a struggle. Like, she loves to watch me brush my teeth. Sometimes she's fine with us sort of manually brushing her teeth. Other times she cries. I'll still try to get a quick brush in there. But do you have any advice around nurturing a healthy relationship for children around brushing their teeth and oral hygiene?
And would just chewing things be enough, if you would add to that? Like chewing on an apple or a carrot or a piece of, fruit or something like that. Would that work as well?
Yeah, roughage, natural, like raw vegetables, raw fruit, as long as they're not too sweet, are a great way to remove plaque. So traditionally you'd bite into a carrot and that actually clears the plaque for most of the teeth, about 70% of the teeth surfaces. We still need to brush around the gum lines because that's where a lot of the bacteria kind of gets stuck. You don't bite all the way into something, right up to the gums. But for little kids, I always recommend, if you can, get an electric toothbrush. With the smallest head. One, it makes it fun for them. It encourages them. But also a small toothbrush, electric toothbrush does most of the work for them. They don't have to brush for so long. So even if they just did it for 10 seconds and they're out, because typically they're not standing around for 2 minutes, then at least you've had extra help with the bristles, and making sure we're using a toothbrush with the smallest head that you can find. So oftentimes we're using an adult toothbrush in a child's mouth. It's quite painful. You get it, it feels like it's jabbing into the gums. It's moving the tongue out of the way. It makes them gag. So small head, soft bristles only toothbrush. If it's electric, great. And when we're using electric toothbrush with kids, not just the vibrating ones, the battery operated, they do nothing. You want one that oscillates or rotates. Yeah. So we want that rotation. We want that pumping, because that's what's going to go around and clear all of the plaque. But modeling is such a great tool for parents. I think we underestimate modeling, whether we're learning how to tie our shoelaces, getting dressed to go out, what we wear, what we don't wear, what we eat, what we don't eat, screen time. All of that modeling from parents is going to be the number one effective tool that
you recommend soft bristles as well for adults?
Yes.
Or just
I would never recommend a medium or a hard toothbrush for adults. Very, very rarely if a patient doesn't have enough dexterity, so an older patient or a frail patient who's not able to put enough pressure when they're brushing, then we would say use a medium or a hard toothbrush because we're not getting enough effective plaque removal with the soft toothbrush. But apart from that, every adult should just be using a soft toothbrush.
I think that's everything
Zohra, like
I've ever thought about.
excellent advice.
Yeah.
Thank you so much, ladies.
There's still
You guys are great to chat with. It's really fun.
There's still stuff going on in my head, but we're going to stop it there because it's almost 1:30. But thank you so much for sharing your expertise with us today, with our listeners.
It's just so much for people to know.
I think they're going to really enjoy this episode. And there's this, you know, bringing things back to basics is really what we're about. And I feel like this was such a great episode to just really, you know, shine a light on that philosophy that we have of everything comes into our mouth.
Honestly,
everybody eats, and so if you're somebody that eats, you need to be concerned about your oral health. And you know, starting that awareness from a young age, and you know, being that a lot of our listeners are mothers, being able to support our children and model these good behaviors, and being aware of what to look out for. I think,
and cutting through the BS.
Yes,
like it was nice, clean cut information. You know, it helped people just at least narrow down the important things they need to concentrate on, cut out all the rest of the noise, which is there's so much noise.
And you guys cut out
a really good job at that.
What was too much rambling, too much talking, too much information, or stumbling. You guys can cut that out.
That's good.
Zohra, where can our listeners find you? Obviously, you've got a practice. So where can our listeners find you? Where are you practicing? And how can they sort of book in if they're interested?
Yeah, so our clinic is Balance Smiles Dental in Dandenong North. We're located in the southeast, but we welcome patients from all over Melbourne, and certainly we do have patients traveling. We also offer telehealth appointments as well, specifically for myofunctional therapy. So a lot of those modifications, those exercises, that can be done through Zoom. Yeah, so
basically what I need. Yeah.
balancesmiles.co for the website, or you're welcome to follow us on Instagram.
Balanced Smiles.
Balanced Co.
Balanced Co.
Yeah.
Balancesmiles.co, correct.
Yeah, amazing. All right, well, we're going to pop all your details into the show notes.
Awesome.
But thank you so much for joining us. And
thank you for having me.
So much.
Sharing all of the pearls of wisdom.
So good.
For all of our listeners, please don't forget to like, share, and subscribe, and to support.
Give us some feedback as
our work.
Yeah.
And share this episode with your loved ones. And if there's any other similar sort of content or oral health, or even maybe a part 2 with Zohra, because I feel like there's so many topics that we could discuss.
It's such an important point. Yeah.
But do let us know, and we look forward to seeing you soon in our next episode. Thanks for tuning in.
Thanks, Zohra.
All
right.
Thanks for listening.
Bye-bye.
Thanks, people.